Hi everyone, my name is Anita Iyer and I run Ekansh Trust in Pune. Ours is an NGO that works to empower persons with disabilities. Demystifying Disabilities is our video series where we talk to medical experts about prevention, detection, and early intervention. Unlike the popular definition of early intervention, it is not only about children, it is about intervening as soon as a disability or a disease or a disorder is diagnosed. Today, we will be talking to Dr. Sarang Rote, who is a very reputed neurosurgeon. Thank you, Dr. Rote, for being on our series.
Thank you for giving the opportunity for a right cause.
So, Doctor, my first question to you will be that of a layperson. What is your scope of work as a neurosurgeon?
So, neurosurgeons are generally related to the brain and spine diseases. So, mainly it is the surgical part, and we are neurophysicians help us in the medical line of management part. So, neurosurgeon generally treat the conditions like head injury, spine injury, conditions related to brain tumors, infection, and spine related tumors and infections.
Right.
Even the epilepsy surgery is also there.
So, what are the related disabilities, like the mobility impairment that comes sometimes because of a tumor, or what are the
Yes,
other disabilities?
mobility impairment, then hearing, vision, all this we see very routinely. So the number one cause of the uh, disability is the head injury. In fact, India is the capital of the head injury, the highest number of
Oh,
RTAs and head injury we have. So if we get the patient in the right time, then we first is to save the life and save the morbidity and disabilities. So
right.
it depends on the which part of brain get injured. Accordingly, the disability can be happen.
Okay, so this is why we talk so much about helmets for people who are riding on two-wheelers and
Yes,
um, well,
absolutely. That's
yeah.
why helmets are
So,
must because each and every cell of brain matters.
what about tumors? What would you want to say about tumors in the brain or
So
in the?
the tumors, like if it depends on the which part of the brain they are arising from. So like when it is the like pituitary tumor or something, it compresses the optic nerves, which can present with the visual deficit. And
Right.
if a tumors which are like in the backside of the head, like CPNG tumor, they present with the hearing loss.
Oh,
Tumors
okay.
which are present in the parietal area or the posterior frontal part, they present with the weakness of the upper limb and lower limb. All these disabilities they can present.
Okay. And what about the spinal cord?
Spinal cord, it is like if there is a injury or a tumor of the spinal cord, generally the patient present very early because there is no much space and the pressure symptoms appears early.
Okay.
So if there is a spinal cord injury, it can be either complete or incomplete. If there is a complete spinal cord injury, there will be a complete loss of function below that level. And if it is incomplete, there is some function. So if the spinal cord injury is at the neck level, then the patient may present with the quadriplegia, like there is no movements in any of the limb. And if it is in the torso or the lumbar region, then it can present with the both lower limb plagia.
Right.
So
So when
in
we
time
talk about
present,
something like cerebral palsy, is it a reversible condition or does it just have to be?
no,
Uh,
it is not reversible condition.
it is not a reversible condition. Are there any reversible conditions that we've spoken about here when we talk about a tumor? If it is removed on time, can the condition be reversed? I mean, when it comes to paralysis or
Yes,
uh,
definitely. Though the major maximum number of tumors are the malignant tumors, the high number of patients come with present with the benign lesions. Benign means they don't behave like a cancer in the other parts of body. The only
right,
problem with the brain tumors is their location because there is no much space in the cranial cavity, and that's why these lesions, these tumors in fact, they compresses the brain, and that's why the patient present with the disability related to that.
right.
Some tumors which are outside the brain and inside the brain coverings, like meningioma, they have really very good outcome and they are quite reversible. Recurrence rate is very high, very less, sorry.
Are any of these conditions preventable? Other than the accidents, of course, they are preventable, but the injuries are preventable. But conditions like tumors, benign tumors, can they be prevented? any of
No,
these?
tumors, and it is not preventable because there is no definitive cause. Like there is some causes which are known, like radiation can cause, but mainly it is some genetic aberration which can lead to this tumor formation. So it is less likely that we can prevent the brain tumors.
So diagnosis is most important in this case.
Diagnosis is most important, and for that, when the patient reach to the primary care or the general practitioner at that level, one has to keep in mind that when a patient comes with the headache with associated other symptoms which are not relieving the medicine for a long time, or which is progressive in nature, then a CT scan and MRI should be done as early possible, because now it is widely available. So you
Right.
can diagnose it early, and when you diagnose a tumor early, you can treat it in an early stage before it invades the brain in a bad fashion.
What I've been seeing, we've been talking to gynecologists, etc. Also, when we were talking about pregnancy and even infertility, etc. So we find that infertility is on the rise, and we also find that PCOD, which is polycystic ovary syndrome, is on the rise, and women are being bombarded with hormones for every little problem that they have. I believe
Yes.
that if the person has a tendency to develop, tumors in the brain, even these hormones could lead to that. What do you have to say about that? And how can we
What
keep check?
what we have seen that those patients who are taking these hormonal pills, rather than presenting with the tumor, they present with the blood clots in the vessels. So
Right,
it is either CVST, or in fact even it is a major arterial stroke also.
right,
So so it should not be used for a long time, and if it is done, then if the any warning sign is there, as soon as possible the investigation should be done, because simple blood thinners can prevent the major devastating
right. So,
episode.
what are the major signs that a woman should look out for? Because again, like I said, women who are working, who are in careers, high performing careers, they are setting aside pregnancy for a later date. I have heard of women who are freezing their eggs and getting pregnant when they want. So I'm sure there is a lot of involvement of
So
hormones
the
there. What are the
major
signs?
symptom they present with the headache. So
Right.
that is the, if the headache is like persistent, it is continuously you are having the severe headache, you should seek a specialist help.
Right. So headache is the only symptom. Anything else that they should look out for?
They
Giddiness.
can have the giddiness or some blackening in front of the eyes, but those are vague symptom. The main symptom is the headache.
Okay. So what is given this scenario where you say that prevention is not really possible, it's mainly about diagnosis. What would you like to say to the general physicians and the neurologists that you work with? People from your space. Is there anything that you would like to say to them? Have you ever felt while conducting an operation that you wish the patient had come to you earlier? And what would you like to say to the others in this context?
So neurologists are the one which are very helpful for us because they pick up it very fast,
Right.
sometimes even before the neurosurgeon,
Right.
and they get it diagnosed, and then the patient is generally referred to us. But
Okay.
it at the periphery level, who doesn't get the neuro patient very frequently, at that point they miss this patient and the symptoms.
Hmm.
So I would like to tell them that if you find that the patient is symptoms are not relieving with the symptomatic medicines for a long time, so as early as possible get a CT scan or MRI done, because MRI there is no radiation, so you can always do MRI, and availability is very good nowadays.
Right.
So even if it is negative that there is no abnormality, that is fine. But if you miss something very severe, then it could be a problematic. In fact, I have a doctor patient who treated himself for a headache considering it is a migraine, and
Oh,
after 5 years he landed up that he was not able to sit or walk anything, and there was a huge tumor of 7 centimeter size. So
wow.
now he's absolutely fine and practicing, everything is okay because that was the benign lesion, but this can happen.
Good. I'm glad that you've said that so that we can be more careful in future. What about Parkinson's? That also comes under neurology. So, what would you like
So
to?
Parkinson's, now the first choice of treatment is the medicine, and they are very well controlled with the medicine. But with the nature of disease, as it is a progressive disease, So it goes on increasing, the number of medicine goes on increases. There is a neurosurgeon's role is like for the deep brain stimulation, but cost factor is a very big problem in India,
Okay. And what
because
epilepsy?
epilepsy also, the first treatment of choice is the anti-epileptic drug. To start with the single drug, then they increase the dose. If it doesn't stop, then the second drug, increasing dose, then the third drug. When it is a refractory epilepsy, that is, it is not responding to the medical line of management, and the patient is having a lot number of episodes of seizures in a day, his lifestyle is hampering, that time there is a role of the epilepsy surgery. There are different types of the epilepsy surgery, but those are like patient specific. So after the studying, we realized what is the exact problem, and accordingly we designed the epilepsy surgery.
Thank you so much for that. And if there is any, do you have any message for our audiences, people who are watching this interview, please?
So I have a simple message that don't shy to seek a treatment or a specialist opinion. If you feel that your problem is not getting relief, seek a opinion. If there is a head injury or spine injury patient, as early as possible reach to the hospital. In spine injury, it is important to immobilize. So use the spine board or any hard surface so that there is no more movement of the spinal cord and increase in the injury.
Right.
And even if you feel that the condition is not treatable, don't take a decision on yourself. Let the specialist decide whether this patient can be treated or not. Because we have seen many patients that somebody told that this cannot be treated, and when we investigate, we found out that it is a benign lesion and can be treated very well.
Thank you so much, Doctor, for your time and for this interview. I'm sure that a lot of people will benefit from watching this interview. Thank you for your time, and thank you for all the information that you have shared with us. I thank MQ Pharmaceuticals for being our sponsors and my team for the back-end support. Thank you to the audiences for watching this. I hope this has been as informative for you as it has for me.